This is a 45-year-old female. Her intestine is very soft, easily inflated by air, well-rounded without any residual stool or mucus abnormality. This is a 65-year-old male who has been on a typical American-style diet consisting of at least 60 to 70% animal protein. He suffers from high blood pressure with an enlarged prostate. There are numerous diverticular openings. This is a 60-year-old Caucasian male with a congenital varicose veins in the colon. There are no known enlarged veins in other organs or parts of the body. He has been on a high animal diet consisting of large amounts of cheese, yogurt, and a glass of milk a day, with red meat approximately 4 times a week for the past 3 years. On this examination, he was found to have high blood pressure, high cholesterol, with a moderately enlarged prostate. Colonoscopy showed these congenital varicose veins, as the picture shows on a 3-year follow-up colonoscopy. Examination revealed a small and very early carcinoma of the cecum located over the mucosa of a prominent varicose vein. This is a 38-year-old Japanese woman who has been suffering from chronic constipation for many years. Her diet consists heavily of a Western-type menu, including white bread, yogurt, cheese, fruits, and cake once a day. She consumes 3 to 4 cups of coffee and tea a day. There was insufficient daily intake of water. She has been on various kinds of laxative every day, including Seneca, aloe, and other herbal medications for years. There are marked pigmentation and spasm. 5-year-old female with breast cancer. 6 months prior to this exam, she had a lumpectomy and radiation treatment. There are marked fecal retention in this picture. This 62-year-old male had been on a typical American diet with daily consumption of red meat, milk, and cheese. This picture shows multiple diverticular openings with impacted fecal matter. He had advanced heart disease, markedly enlarged prostate, and arthritis of the legs and fingers. This is a 21-year-old Japanese male who has been suffering from marked inflammation and ulceration of the distal part of the small intestine. This is typical Crohn's disease of the small intestine. He has been suffering from frequent diarrhea and abdominal cramps for several months. Despite his dislike for milk, he was encouraged to drink milk by his parents and at his school lunches. The endoscopic view shows various size mucosal ulcerations. This is a 72-year-old Caucasian female who came in with a sudden onset of abdominal pain and rectal bleeding. Colonoscopy showed a marked narrow, swollen, inflamed, discolored, and hemorrhagic mixture with necrotic areas. This is a typical appearance of ischemic colitis. This condition can develop through disturbance of the arterial circulation of colonic walls adjacent to blood vessels. The patient has known arteriosclerosis, heart disease, and high blood pressure. Her diet is a typical American diet with a heavy intake of red meat, chicken, and high intake of dairy products.